Hi, here I am for the fifth or so time making another orthodontic video. As you can see, I'm in another orthodontic appliance, which I'm happy to tell you about. If you are not yet caught up on my journey, I had braces as a teenager. I was born without a tooth in one spot. So when the braces came off and I had that gap, my parents were told to seek, additional treatment, whether that be an implant or whatnot. Didn't do that. So many years later, as an adult, I started to have some side effects. My TMJ was getting a little bit worse. I started to have soreness, and I just decided it was in my best interest. And now that I could afford it myself, that I would go ahead and get that implant. The only downside there was that I needed to get braces again to widen the gap enough to get the implant. So the videos that I have up on my channel range from all the research I did, the costs analysis of getting braces again as an adult, all of the options and why I did not qualify for Invisalign. It covers all and any complications that I went through. There are some follow-up videos. Some of my teeth started to separate, so I had to get dimples put into the retainers and try a few other things. I had the implant and the abutment. The only thing that went wrong with the abutment is that the abutment cap fell off. And I had to go back and have them pretty much like cookie cutter punch out part of my gum in order to get that back on there. So that kind of stunk. And now that I have the crown, I'm happy to show that off. And additionally, I am in another appliance, and that is because my two front teeth began to I had differing lengths. So I've had them off since September, and at the time of this video, it's February. So the length kind of went up a little bit on the one side. So in order to pull that down, I was a little concerned about what the options were. They're trying to pull the tooth into my retainer. So the retainer is there as leverage. And what they're doing is they added a small acrylic button to the front top of my tooth. It's kind of like an acrylic bracket. It's just very high up. And then they've done the same thing on the reverse towards the top. But in addition to being an acrylic button, it has a small metal hook. Doesn't interfere with anything. You can barely feel it. Doesn't hurt whatsoever, but it is back there. And the reason for that is I've taken a small rubber band, the same type you use during your orthodontic treatment, and you're connecting it from the top button to the back hook. And what it's doing is it's wrapping that around the retainer. So it's using force to pull your tooth down into the retainer. I'm lisping more than I was with the actual braces, and that's because I have to wear this retainer. With the rubber band being on my front teeth in the back, your tongue is hitting it, so you do sound a little bit differently. The best news is that it's only for 2 weeks, so this is only a 2-week treatment. I'm actually getting it off tomorrow morning, so it is almost perfect. I've got a little picture here to show you what it started out as when I started noticing. I'm a big advocate for, raising concerns. A lot of my friends said, you're crazy, it looks fine, they're better than anybody else's teeth. It really wasn't good enough for me. I spent a lot of money and a lot of time getting my teeth to where they needed to be. When I started seeing shifts like that, it's all I can focus on in the mirror. So if you're noticing changes and you've had orthodontic treatment, go back to your orthodontist. I know it might be 30 minutes away. I know that it might not be covered any longer. In my case, it was still covered. I have like 1 year to kind of adjust and fix and make sure that everything is to my liking. So hopefully this will be the final video. Hopefully tomorrow I get this off and then I'm all done. I'll give you a look at the crown. The cool thing about the crown was that I got to work with the dental assistant and the dentist to color match my crown. And the procedure to put the crown in was 20 minutes tops. Barely any pain. The only discomfort is when they're kind of pushing it down on there with the cement inside and they're flossing around it. They have to make sure that it's nice and tight, and it does feel tight. The moment they put the crown in, you almost feel like you have braces on again, like everything kind of snaps together. That pain alleviated within hours. It's now the next day, and I don't feel that discomfort any longer at all. So hopefully this will be the end of it. But here's a look at the crown. So I'm aware that it looks like a different color when you open your mouth, but it blends in when you're smiling. And to me, that's what mattered the most. So your teeth have different shades all the way around them. You might not realize that, but they do. But with a crown, it's really not that fancy. So you pick one shade. So I was happy with the shade that I had chosen. Does it feel like the rest of my teeth? No, it does not. My tongue is constantly touching it. And that's mostly because my whole life I never had a tooth there. So in the past few months, I've had the abutment cap sitting there. So it's been like I've been warming up to the idea of something being in that area. But this tooth, although it seems small to you, feels huge in my mouth. That's what she said. But it does. So it's uncomfortable. It's a little weird. When I chew, like I can tell when it's hitting top and bottom, like when I've got food in there. But I can also tell already that I'm going to get used to it. So hopefully this answers some more questions. Again, if you have any questions for me, please put them in the comments. I'm always looking. I'm always happy to help. And good luck with your own dental journeys.